I first want to ask you about the impact of this event. How do you see technology being, impacting what we're talking about today in terms of clinical staffing?
Well, I've been so excited about this event. And I think if I think about why I was so excited, it's really bringing together all of the stakeholders we all have the same goal. It's to improve patient outcomes and to give the best patient experience to every patient, every family, every time. And I don't mean that to sound like a cliche, but it's really what we're all about. But we don't always do a good job being at the same table together at the same time for lots of reasons. And I think things like today break down walls and allow people to start having those conversations. So we all make better decisions about technology that impact patient care and patient outcomes.
Oh, very good. No, that's great. Um, there was a lot of discussion involving nursing from the inception of these design projects. What is your stance on getting nursing or the clinical staff involved early on?
Well, with your question of about involving nurses early on in a process or project, I'm a little biased, being a nurse myself and being a chief nurse. That said, the importance of including frontline providers. Nurses are so important, but any healthcare provider that is involved in using that piece of technology or in that improving that workflow, having them involved from the project's inception is critical. And many healthcare leaders have learned after maybe several mistakes, for me maybe more mistakes than I'd like to admit, that you're not going to get the best answer if the frontline providers or those involved in the actual process aren't involved, and involved from the beginning. I mean, it's a key tenet of improvement science. Frontline, hands-on caregivers, that's when you're going to get your best answers and best solutions.
Sure. Oh, that's very true. So with all of the issues that we've talked about, all of the barriers that we had to break through, where do you see technology going in the next 3 to 5 years? What progressions would you like to see?
Well, the next 3 to 5 years for healthcare, there's so much change, and we're all dealing with a lot of new regulation. I think what we all agree upon is how much of healthcare reform or what we're going to see is unknown. We all agree that it's unknown, and we agree that there's a lot of change. And what I see in technology, my opinion is that it's going to explode. And the impact of technology on healthcare providers, how they work, when they work, how they do their job. But I think it's incumbent upon leaders, and what I'd like to see is leaders at every level, whether it's physicians, nursing leaders, frontline leaders of care, being involved in leveraging technology and seeing how it all works and integrates. That's what I see. I see that the level of integration of technology and workflow and care, that's where I see the explosion happening, and explosion in a good way. I should probably find a more positive word than explosion. But that's where I see the focus.
Right. Well, very good. Well, very well put.
All right.
Thank you so much.
Garrett, thank you.
Thank you.